Moderate community-acquired pneumonia can be treated with amoxicillin, clarithromycin, or doxycycline. 13. Moderate community-acquired pneumonia can be treated with oral amoxicillin plus clarithromycin again. So, yeah. Then 14 is cefuroxime. Severe community-acquired pneumonia requires intravenous therapy of co-amoxiclav, cefuroxime plus clarithromycin. Patients with suspected Staphylococcus aureus pneumonia should receive intravenous flucloxacillin and rifampicin. Let's go ahead. 16. For Legionella pneumonia, a fluoroquinolone is combined with either clarithromycin or DASH. 17. Pneumocystic jirovecin pneumonia is treated with high-dose DASH. 18. Hospital-acquired pneumonia is often caused by gram-negative bacilli, Pseudomonas, and DASH. 19. For aspiration pneumonia, intravenous cephalosporin is combined with DASH. Okay, so the first answer for 16 is rifampicin. Legionella pneumonia, a fluoroquinolone is combined with either clarithromycin or rifampicin. 17 is cotrimoxazole. Pneumocystic jirovecin pneumonia is treated with high-dose cotrimoxazole. 18 is anaerobes. Hospital-acquired pneumonia is often caused by gram-negative bacilli, Pseudomonas, and anaerobes. For aspiration pneumonia, 19, metronidazole. Intravenous cephalosporin is combined with metronidazole. Let's go to 20. In neutropenic patients, pneumonia is treated with IV aminoglycoside plus DASH. If fungi are suspected in neutropenic pneumonia, DASH should be added after 48 hours. 22. Pneumococcal vaccination is recommended for individuals aged -years and above. 23. Chronic conditions like heart disease, diabetes, and immunosuppressions are indications for DASH vaccination. 20. Let's look at the answer. Anti-Pseudomonas penicillin. So, in neutropenic patients, pneumonia is treated with intravenous aminoglycoside plus anti-Pseudomonas penicillin intravenously. 21. If fungi are suspected in neutropenic patients, that should be added after 48 hours. Those are antifungal. Pneumococcal vaccination is recommended for individuals aged 65 years and above. Chronic conditions like heart disease, diabetes, and immunosuppression are indications for DASH vaccination, pneumococcal vaccination. 24. A contraindication to the pneumococcal vaccine is previous DASH. 25. The pneumococcal vaccine should be administered every -years in at-risk group. The first line, 26, the first line oral antibiotics with mild community-acquired pneumonia is DASH. 27. If a patient cannot tolerate amoxicillin or alternative oral options for mild community-acquired pneumonia, clarithromycin or DASH. 24. Anaphylaxis. A contraindication to the pneumococcal vaccine is previous anaphylaxis. Pneumococcal vaccine should be administered every -years in at-risk group every 5 years. The first line oral antibiotic for mild community-acquired pneumonia is amoxicillin, oral amoxicillin. If a patient cannot tolerate amoxicillin, alternative oral option for mild community-acquired pneumonia. If a patient cannot tolerate amoxicillin orally, alternative oral option for mild community-acquired pneumonia is clarithromycin or doxycycline. 28. For community-acquired pneumonia, the recommended intravenous antibiotic combination is aminoglycoside plus dash. For aspiration pneumonia, the primary bacteria involved include Streptococcus pneumoniae and dash. In severe community-acquired pneumonia, treatment duration may extend to dash days if Legionella or gram-negative bacteria are suspected. 28. Anti-Pseudomonas penicillin. For hospital-acquired pneumonia, the recommended intravenous antibiotic combination is aminoglycoside plus anti-Pseudomonas penicillin. For aspiration pneumonia, the primary bacteria involved include Streptococcus pneumoniae and dash anaerobes. For aspiration pneumonia, the primary bacteria involved is Strep pneumo and anaerobes. 30 is 14 to 21 days. In severe community-acquired pneumonia, treatment duration may extend to 14 to 21 days if Legionella or gram-negative bacteria are suspected. 31. A 65-year-old woman presented with COP65 score of 1. What is the recommended oral antibiotics? 32. A 37-year-old man with diabetes and pneumonia requires a vaccine. How often should he receive it? 33. A patient with pneumonia is found to have pattern valentine leukocidine producing Staphylococcus aureus. What's your next step? 31. So, you give oral amoxicillin 500 to 1 gram 8 hourly or oral clarithromycin 500 mg 12 hourly or oral doxycycline 200 mg start or loading dose then 100 mg daily, once daily. So that's the answer for a 65-year-old woman who presented with COP65 of score 1. What's your recommended antibiotic regimen? So the next one is every 5 years you give your vaccine. A 72-year-old man with diabetes and pneumonia required a vaccine. How often should they receive it? 5 years. And the last one is seek urgent help and consider intravenous linezolid, clindamycin, and rifampicin. So if patient with pneumonia was found to have the PVL Staphylococcus aureus or PVL-SA, what's your next step? So you seek urgent help and consider intravenous linezolid, clindamycin, or rifampicin. A patient with hospital-acquired pneumonia has gram-negative bacilli on culture. What is the appropriate intravenous treatment? A patient has aspiration pneumonia. What intravenous antibiotic combination is recommended? Let's go ahead. You give aminoglycoside intravenous, anti-Pseudomonas intravenous, or third generation cephalosporin to a patient with hospital-acquired pneumonia that has gram-negative bacilli on culture. The appropriate treatment or line of treatment is give intravenous aminoglycoside plus anti-Pseudomonas penicillin intravenously plus third generation cephalosporin intravenously. And the last question is give cephalosporin intravenously plus metronidazole intravenously. Patient has aspiration pneumonia. What intravenous antibiotic combination is recommended? You give cephalosporin intravenously plus intravenous metronidazole. Thank you very much.